is Vince Gerald M. San Miguel, a first-year nursing student from Nueva Ecija University of Science and Technology. And today, I will be performing backing an adult client. So, let's go! For the assessment for this procedure are first, assess the client's ability to assess with the procedure, assess the client's comfort with the procedure, and lastly, check your environment and check your equipment. For the planning for this procedure, for the expected outcomes for this procedure are first, the clients will be clean without damage to their skin. Next, the client's privacy will be maintained throughout the procedure. The client will be participate in their own hygiene as much as possible. And lastly, the client will not overly tired.
For the equipment needed for this procedure are first, bath towels, washcloths, bath blanket, wash beans, soap, soft dish, lotion, deodorant, powder, clean gown, clean linen, and disposable gloves.
For the implementation for this procedure are first, ask the client about preference in their own bathing. The rationale behind this is to provide opportunity to participate the client. Next, explain to the client the procedure. The rationale behind this is to enhance the participation of the client. Next, prepare the environment. Close the door, close the curtain. The rationale behind this is for the client to prevent the chills and for the privacy for the client. Then, wash your hands and apply gloves. The gloves should be changed every emptying the water basin. The rationale behind this is to reduce the transmission of microorganisms.
Then, lower the side rail on side close to you. Position the client in a comfortable position close to the side near you. The rationale is prevent unnecessary reaching, facilitates use of a good body mechanism. Then, if bath blankets are available, place bath blanket over top sheet. Remove the top sheet from under bath blanket. Remove client's gown. Bath blanket should be folded to expose only the area where clean at the time. The rationale is prevents exposure of the client, promotes privacy, and protects for the chills. Fill the wash bin 2/3 full. Permit client to test temperature of water with hand. Water should be changed when a soap film develops or water becomes soiled. The rationale is prevents accidental burns or chills. Then, wet the washcloth and wear it out. The rationale is prevent unnecessary wetting of the client. Make a bath mitting with a washcloth. To make a mitting, grab the edge of the washcloth with the thumb, fold a third over the palm of the hand, wrap remainder of cloth around the hand and across palm. Grasping the second edge under the thumb, fold the extended end of washcloth onto the palm, and trunk under the palmar surface of the cloth. The rationale is to prevent ends of washcloths from dragging across the skin and promotes friction during the bath. For washing the face, ask the client about preference for using soap on the face. Use a separate corner of the washcloth for eye, wiping from inner and outer canthus. Wash the neck and the ears, risen, and pat dry. The rationale is some clients may not use soap on their face. Using separate corners of washcloth reduce risk of transmitting microorganisms. Patting dry reduce skin irritation and drying. Wash the arms, forearms, and hands. Wash forearms and arms using long frame stroke in the direction of distal to proximal. Arm may need to be supported while being washed. Wash the axilla. Rinse and pat dry. Apply deodorant or powder if desired. Immerse client's hand into basin of water. Allow hand to soak about 3 to 5 minutes. Wash hands, interdigit area, fingers, and fingernails. Rinse and pat dry. The rationale behind this is long stroke promotes circulation. Soaking hands soften nails and loosen soil from the skin and nails. Stroke directed distal to proximal promote venous return. Wash the chest and abdomen. Fold bath blanket down to umbilicus. Wash chest using long frame stroke. Wash skin fold under the female chest breast by lifting each breast. Rinse and pat dry. Fold bath blanket down to suprapubic area. Use another towel to cover chest area. Wash abdomen using long frame stroke. Rinse and pat dry. Replace bath blanket over chest and abdomen. Cover chest or abdomen area in between washing, rinsing, and drying to prevent chilling. The rationale behind this is to promote privacy and prevent chills. Long stroke promotes circulation, precipitation, and soil collection with the skin folds. Wash the legs and feet. Expose leg farthest from heel by folding bath blanket to midline. Bend the leg at the knee, grasp the heel, elevate the leg from the bed, and cover bed with bath towel. Place wash bin on towel. Place client foot into wash bin. Allow foot to soak while washing the leg with long, firm stroke in the direction of distal to proximal. Rinse and pat dry. Clean soles, interdigits, and toes. Rinse and pat dry. The rationale behind this is to support joints to prevent strain and fatigue, soaking foot loosens dirt, soft nails, and promotes comfort. Repeat it to the other leg. Wash the back. Assist the client into prone and side-lying position facing away from you. Wash the back and buttocks using long frame stroke, rinse and pat dry. Give back rub and apply lotion. The rationale is exposes back and buttocks for washing. Back rub promotes relaxation and circulation.
After that, perineal care.
For perineal care, assist the client to supine position, then perform perineal care. The rationale is removes genital secretion and soil. Then apply lotion and powder as desired. Apply clean glove. The rationale is lotion lubricates skin, powder absorbs excess precipitation. Document skin assessment, type of bath given, and client outcomes and response. The rationale is to provide evidence of nursing care. Then perform hand washing. The rationale is to reduce the transmission of microorganisms. For the evaluation, the client was cleaned adequately without skin damage. The client's modesty was maintained throughout the procedure. The client participated in the procedure as much as possible. The client remained comfortable during the procedure. For the documentation, nurses note the client was bathed, indicate how much of bath the client assists with and how well the client tolerated the activity. Then, note any unusual findings including rashes, open sores, pure turgor, and so on.